sometimes sad, she's sometimes happy. She's doing things to make her life less crappy. Trying a treatment that's new on the scene. Let's sit back and talk about ketamine.
Welcome to Ketamine Insights, a podcast about psychedelic medicine and mental health. We are not trained experts, and nothing in this podcast should be taken as medical advice. Thank you so much for joining us. If you like what you hear, please support the podcast by signing up on either Patreon or Substack. You can also rate and review the show or share an episode with a friend. All of this helps us reach more people, and we truly appreciate it. All right, so today's episode is a little different because we're talking about a very recent event. On Tuesday, June 4th, we got some very bad news out of the FDA. Their advisory committee voted overwhelmingly against approving MDMA as a treatment for post-traumatic stress disorder. Now, this isn't the final decision from the FDA, but from what I'm hearing, it's unlikely that the FDA will go against its own advisory board. The final decision is scheduled to come in early August. Before this, there had been every indication that the FDA would approve the treatment. They even fast-tracked the approval process based on the extremely promising results from the phase 3 trials. Just real quick, those results, 86.5% of the people within the group that received the MDMA treatment had clinically meaningful improvement 18 weeks after the treatment. So that's 86.5% with clinically meaningful improvement. 71% did not meet the criteria for PTSD diagnosis anymore by the end of the study. So these are really, really promising results, really hopeful. This is the first time a psychedelic has come anywhere near this close to approval in the US. As old listeners of the podcast will know, ketamine is not approved. It's being used off-label, which is why it's not covered by insurance. And the effort to earn FDA approval for MDMA started decades ago. Let me summarize what happened to this effort to get MDMA approved. In general, the FDA usually measures the efficacy of a drug against a placebo. That means that in any given study, half of the participants don't receive the medicine. Instead, they receive a placebo. In order to eliminate bias, both the patients and the doctors are kept ignorant of which patients are receiving the placebo and which patients are receiving the medicine. The FDA does this in order to understand the placebo effect of the drug, and a drug has to perform better than a placebo in order to be approved. The structure of this MDMA study was that they divided the patient into two arms, two groups, and one MDMA group received 3 sessions of MDMA along with therapy, and then the placebo group received 3 sessions of placebo along with therapy. The severity of the PTSD in each patient was measured before, during, and after the treatment. As is usually the case, the applicant designed the study and the FDA approved the study design before the study began. So then here's what happened. The advisory committee had several concerns, and I'm going to go through the 3 biggest ones here. 1, the difficulty of maintaining blindness. It's no surprise to anyone that most patients were able to tell whether they were tripping on MDMA. This is pretty unavoidable when the medicine causes an actual experience. The FDA panel was worried that this introduced bias on the part of the patients and the therapists in the room. The second concern was that there was no standardization with respect to the therapy the patients received. Instead, the therapy was tailored to the patient's needs. Finally, during one of the roughly 500 sessions involved in the study, there was a case of unprofessional behavior on the part of a healthcare worker. I don't know what this was about. I think either a therapist came on to the patient or inappropriately touched a patient while the patient was on MDMA. The investigation for this one is ongoing. So the advisory panel was worried about the safety of patients while under the influence of MDMA. So if you zoom out, the advisory committee had 2 major concerns about the study design and 1 concern about a patient's safety during an MDMA session. I'm just going to say for myself, as someone living with PTSD, I've been watching this process with a lot of hope since 2019. The trials were interrupted by COVID, and since the trials restarted, I've literally been counting the months until I might have access to this new treatment. So when I watched the hearing online last Tuesday, it was deeply disappointing The panel voted 9-2 against the question of whether MDMA-assisted therapy is effective, and they voted 10-1 against the benefits being worth the risks. So that was a heavy result. I was reading about this and trying to collect all I could and came across a quote by Christina Pierce, and I've invited her on the show to talk about all this with me. She graciously agreed. She's the founder and CEO of the Protea Foundation, which focuses on improving the lives of women living with PTSD. So Christina, thank you so much for being here.
Hi, Molly. It's great to be here. Thank you.
Can we start just with you telling us a little bit about yourself? Where are you from? How did you come to start the Protea Foundation?
Sure. I'm originally from Hawaii. As I mentioned in the FDA comments section, I had less than ideal upbringing, and so I had a very, high ACE score. I have been challenged with that through my life, but didn't realize or understand my diagnosis of PTSD until I was in my mid 40s. So I went through our healthcare system being diagnosed and misdiagnosed as having a whole host of other things, the things we're all so used to, right? Depression and anxiety, bipolar disorder. But of course, along with all of those things, then came the progression of the medications that we, apply to this, looking at this through the lens of it being a disease model. So when I was in my mid 40s, finally got the diagnosis, went back to research what other things could be done because I was shocked that the doctors turned around and prescribed the exact same medications that I had been prescribed already. And one in particular was very devastating and actually caused suicidality. I actually
Ugh.
attempted suicide on the medication.
Oh my God.
So, I became very drug averse at that point and just said, okay, I am going to try to live a life of healthy, diet and exercise. I became a competitive triathlete. I was very dedicated to maintaining a very healthy lifestyle. But as we all know from any experience with PTSD, over time, the effects still come in through the doors of the house, and they come, through an increasing number from different kinds of triggers. It doesn't even have to be related to the original trigger. It's like once the structure is weakened and that resilience is worn down, that the triggers start to impact you more and more. And so unfortunately, I wasn't losing the suicidality. I wasn't losing the ability to sort of self-arrest when I was in high stress situations. And so I continued to seek treatment. After realizing that the same exact medications were the only thing that were still available to me, I researched things like ketamine therapy and other, novel therapies. And I happened upon the clinical trial, which was going on with the MAPS clinical trial that was happening in our backyard in Boulder. So that was sort of a, wonderful blessing to have happen, and realized at that point that this might be a possibility, for me to pursue this kind of therapy. So that's how I discovered it. When I went through the therapy, I originally received placebo. And so I consider myself one of the fortunate people that got to go through it twice. And with a real sense of contrast, how did it differ between being an actual talk therapy modality versus it being the dual,
Mm.
having the actual medicine. And then I should say that along the way, just having gone through the trial on placebo, I really appreciated the therapy, the strength of the therapy, and the competence of my therapists in the room. That really inspired me to look toward, gee, what could I do to create more awareness around getting the proper diagnosis much earlier in life? Because I was a very early childhood sexual trauma survivor, and I had this high ACEs score because of all of these adverse childhood events, there was a lot to, untangle. And it's no wonder to me, having gone through the therapy alone versus having the reset or the boost of the medicine, the experience
Mm.
between going through the medicated trial was absolutely life-changing, because in that very first medicated session, and I got three, by the way, three medicated sessions, but even in that very first medicated session, I had such a shift in perception that I was able to push the fire alarm, the bells and everything else that keep you on that fight flight response to everything completely to the side, to be able to process and really start to have time more than anything around unraveling why I couldn't resolve, these early traumas. And there are some amazing insights that I had in that. It happened so quickly because I realized that what I had been experiencing as extreme shame around the sexual trauma, I had completely turned that knife toward myself in judgment, in self criticism, instead of ever being able to connect the dots of, gee, that child, I mean, very young child sitting in that room going through the kind of traumatic experiences that I lived through, didn't know how to cope with any of this, didn't have the emotional capability, did the best she could to basically survive through those circumstances. And maybe that shame didn't really belong with me. Maybe being told that I needed to be quiet and not to tell anybody, what wasn't my responsibility. But the profound difference for me as a sexual trauma survivor was also recognizing that as horrific as the sexual traumas were in and of themselves, the really truly offending trauma was that I did tell someone and she denied it, told me that I was imagining it, and actually shamed me for it by saying, don't you get enough attention as it is? And so, in hindsight, when you're able to push the fight flight to the side and really examine all of the circumstances around it with this added self-compassion that I probably never had in my life, that really helped me turn the corner and unwind a lot of it. Then I had something to work on with my therapists, right? I had something for them to actually be able to help me unwind instead of me sitting there in sessions going, I don't want to be perceived as a victim. I don't know why this bothers me so much. It happened and I'm over it. It's terrible. It happens to a lot of people, and trying to, rationalize my way through it, having that space to really feel it on so many levels and hold that compassion and understand this wasn't about thinking my way through. So that, in a nutshell, I think is one of the real reasons why I am such a strong advocate now for this therapy. And my frustration at the FDA, I feel like I entered a room and I entered the wrong room. I couldn't even get my head around why they were discussing the kinds of issues and the granular details that they were hung up on versus the bigger picture. I've thought about this quote, and it's like, people say you can't worry about the bees when the bears are chasing you. It's like tens of thousands of people each year die from this, and we're sitting there having discussion and quarrel over whether or not a piece of data, was sufficient in this particular, one instance or whatnot. I absolutely am a proponent of safety and efficacy, but I think on both counts, that was absolutely and continues to be proven. This will save lives. I hope that this advisory committee doesn't lose sight of that. Although, again, I want to say that this is sort of like being invited to the Olympics and them not having a sport for us, right? This is a championship, absolutely high performing form of therapy. And then to have a committee that isn't equipped to be able to judge it properly shouldn't penalize the competitor. And that's what this is all feeling like right now.
I couldn't agree more. It feels like first of all, thank you for your story. It's very powerful, and I appreciate you sharing it with us. I think the thing that occurred to me, I used to work in Washington, D.C. in the Senate and in the bureaucracy a little bit. And the thing that occurred to me is just that the throughout the hearing on Tuesday, everybody was bemoaning that there hasn't been a breakthrough in PTSD treatments And they said in, 20 years, but it's been much longer than that. They're talking about the last drug that was approved, which, as you say, is the same drugs for depression, and the efficacy is not very high. So they're bemoaning the lack of progress that we've made. And then this new drug comes with this new paradigm, with this sort of breakthrough treatment where, almost 86% of people are responding. And it just felt like the FDA didn't have the imagination. They sort of threw up their hands and said, well, it doesn't fit into our paradigm. We don't regulate therapy. It doesn't. And it's like, no, that's the point. It doesn't fit into the paradigm that's not working. It's a different paradigm. Come with us.
That's right. It felt like it was a situation where the audience is going, wait, you're not understanding it. The MDMA itself is so well characterized. We know exactly what it does in the human body. We also know exactly what trauma does to the human body. I attended the International Trauma Conference that Bessel van der Kolk hosts, in Boston. And I sat through 4 or 5 days of well-researched neurobiology experts, neuroscientists, behavioral, you name it, one after the other presenting all of this data showing not only do we understand the efficacy of the psychedelics, although we don't understand the exact precise mechanism that makes it work, we can see this window that opens up, right? That we're able to sort of relearn and retrain, and this neuroplasticity that happens. We understand that. We know what the effect is on the HPA, functions in the body. We know the adrenal response. We know what the, what the body does when it responds to trauma and stressors. And so to me, it's like understanding the drug, understanding what the body does in reaction to it, and then we get hung up on this therapy wrapper around it, which is so subjective because that's the challenge of therapy, right? Individuals respond differently to different kinds of therapy. Otherwise, we'd have one kind of therapy available. And, I don't know that we mentioned this today, but, I'm also in school studying, and I'm in graduate school as a mental health counselor, clinical mental health program at Wake Forest. And so again, you have this layer of this understanding of the context of therapy coming in hundreds of flavors. And yes, some are more evidence-based than others, but it still resides with the therapeutic alliance, right? It was hard. It was so hard to watch this one woman in particular, who I know has been brought up, multiple times, because the therapeutic alliance and the modality of the therapy for her didn't work. And then on top of it, her therapists were absolutely in the wrong to then cross, ethical, moral, legal boundaries, after the trial. But now we're holding that so far out of perspective that this is now holding up, tens of thousands of lives. I feel like that is such an important message for us to understand and say, yes, the therapeutic wrapper, we can do more research around that and saying which form of therapy is the most effective. Molly, just yesterday, I did an interview with the Atlantic Journal-Constitution because they're doing a trial at Emory University. And it's a single medicated session, but it's using prolonged exposure therapy in a person-centered approach and trying to see what that does right through their clinical trial population. I believe it's about 40 patients who have been selected for this trial. And so again, I think, of course, there are ways to improve upon the efficacy, but we are improving from 87%. That is one heck of a baseline, right? To fine tune a medication. Name any other medication, any other drug in our arsenal where we have the risk profile of MDMA with guardrails of having therapists in the room while it is being administered, right? And let's hold that in perspective for a moment, instead of paying attention to the one spinning top that veers off and then allow fear to really, bind us. I think that's the biggest tragedy out of that process that we all
And you're
witnessed.
referring to, there was one instance that they talked about at the hearing the other day, where out of about 100 patients, there was one where there was malfeasance. They didn't really go into what exactly happened, but there was one incidence of the therapists acting out of turn, and that is one of the things that has derailed this investigation. It looks like the investigation into MDMA. Yeah.
Yeah, yeah. It's, because again, you're going to have a bad actor in a system-wide process no matter what. But again, you can't throw everything out, right? The baby with the bathwater, certainly comes
Hmm.
to mind. But I do know, after watching that advisory committee, and particularly trying to understand the makeup and who the members are on the committee and why their opinions would hold so much weight and sway with the FDA, keeping in mind that the FDA themselves have been working with MAPS
That's the
on
thing that
this
I don't
trial, on the
understand.
design, for
Yeah.
decades. And they're the ones who signed off on saying, yes, this is novel. It is going to be a big challenge in anything that has any sort of mind, perceptive shift
Hmm.
altering component to it, to blind that kind of
Right.
a study. And their solution was to have a third party rater then judge whether or not they could tell if the patient, right, had had the
Right.
medication afterwards, which seems like a pretty good
Right.
solution. But then to have that exact trial design be criticized at the hearing itself then was very difficult. You, having a DC background, would appreciate, I think, this. I love this quote, but it's always, there are things you don't want to see being made, and that's laws
Hmm.
and sausages. And I'm going to add FDA
Oh my
advisory committee
gosh.
meetings, approving
Hmm.
drugs to that list.
Yeah.
Um, because that was just
It was a
a
known
mess.
it
That
was
was a mess.
known, of course. So it's difficult to do blinding when the pill is not an inert white pill that you take and you don't know if it's doing anything to you. The the medicine is an experience. And so of course it's going to be difficult
Right.
to do a double blind study. But like you said, they knew that that was a risk. They knew that was a problem. They planned around it, and the FDA agreed to the study design. And then the
Exactly.
advisory committee turned around and criticized that very design that had been worked on together between FDA and MAPS. So that was one of the huge disappointments, that it just, between that and the FDA putting it on fast track, and then the committee putting the brakes on so completely, it felt like they're really just not on the same page as each other. And I was wondering the same thing as you, like, who is this committee made up of, that they have such a different kind of, like, almost different philosophical approach to what therapy can work for PTSD and illnesses like it.
And imagine the culture clash between the psychedelic
Yeah.
sciences, right, and traditional clinical medicine, and then, legislators, regulation, and, people who are, very risk averse, right? So, we had a lot in the room. And the biggest thing is, though, this should have accounted for that, because we can anticipate that there's going to be very different schools of thought coming at this. But again, we can't lose perspective of real lives hang in the balance here. And so cultural issues, or sort of paradigm shifting
Right.
that needs to occur, to really truly sort of, I want to say, accurately perceive any sense of risk with this medication. I really truly believe that if they need a second committee meeting, they need to reconvene and run this through again. And or I really strongly believe that the committee that actually makes a decision, this needs to be one of those historic moments when they don't stand by the
Mm.
recommendation. They need to go through their own assessment. I'm fully confident that Lycos is going to give them the data that they,
Hmm.
need, um, and that they will, in fact, I'm very optimistic they're still going to pass this. So, I'm going to be in that minority right now and say, yeah, they completely messed that up in that AdCom meeting, but I think there's still very strong indications for hope, because I think the data really
That's
speaks
interesting because
otherwise.
I had heard that maybe Lycos, which is the applicant, the company spun out of MAPS that created the application for MDMA, that they might withdraw their application and redo the phase 3 trial and sort of not do a full reapplication, but kind of start over from phase 3 and go forward again. But I don't know if that's even allowed or if that's how it's done. It certainly would set us back years if that was the next step.
It would certainly set us back years. I think even and so again, this is at what cost? Like
Right.
I asked at the original hearing, right? A lot of people are still waiting for this. And I want to say, if the difference is between individuals feeling like they're at their wits' end and this is something that they just can't live with anymore and they're contemplating suicide, whether or not there are some side effects or whether or
Right.
not they have therapy and need to change therapists midstream, just really seems like a
Yep.
manageable risk. So again, I go back to the MDMA is well
Mhm.
characterized, the therapy wrapper needs to be well formed, but this committee was not the one to make that judgment. I just really hope there's some other way to address this. I don't know if this is,
Mhm.
congressional, interview. I don't know if you have any a sense of what kinds of other alternatives there would be to having to reapply
I
entirely to
don't,
the
this
FDA.
wasn't the area that I focused on when I worked in the Senate, but I I did focus on medical research, and I don't know of any
Mm,
way for Congress even to intervene without, I mean, all they can do really is give money to the NIH, even the Department of Defense now has money to do this kind of research, which is a great step forward. But as far as like actually getting approval
absolutely.
for the drugs, I don't know myself of any way that they could help. And as slow moving as they are these days, it might not be faster, unfortunately. But I think you're right that there was just such a real lack
Yeah.
of like liaison work. It feels like, as you said, they were speaking different languages. And the idea that they don't regulate therapy and therapy was part of the intervention, and that they always rely on blinding, and blinding is a lot more complicated here, if not completely impossible, just put up this wall that they couldn't, and the consequences are
That's
suffered
right.
by the people with PTSD all over the country at home trying to figure out what to do without a lot of help from the medical system.
That's right. And on top of that, again, another component of raising awareness around this issue is the number of people that are yet to be diagnosed with PTSD. So many people,
Interventions
and
we have.
particularly what we know now about, particularly with sexual assault victims, and realizing how many of those go on to develop PTSD. The rates are so phenomenally
Right.
high, higher than veterans, higher than, any other category. And so for so many of those, because it is a crime of shame on the part of the victim instead of on the perpetrator, right?
Mhm.
It never gets reported. It gets put under the rug, never to see the light of day. And so you never connect the dots that that's the reason why you are suffering from so many other
Mhm.
things, because you continue to look at it as, why can't I get over this? Or even though I'm over this, why is it still impacting my life?
Mhm.
And so to me, I'm really worried about the number of victims out there, on the full gender spectrum, that aren't even in this head count, and could really be helped by this therapy. And this
Yeah.
delay is impacting all of them as well, and their communities and their families and their loved ones. And, it just ripples.
Yeah. It's a great point, and I think having a successful treatment would possibly bring people into the diagnosis. And if there's hope for the
Yeah.
diagnosis, instead of, I'm one of them who's sort of wallowed in this world of treatment-resistant depression for a decade without, and, a big reason for quote unquote treatment resistance is trauma. And you're not going to get better in a lot of cases without addressing the underlying trauma that's causing the depression. And you can treat it with all the SSRIs that you want, but without the insight
Yeah.
that you mentioned earlier, you're not going to get very far in a lot of cases. And I'm one of those cases.
The current medications, from my perspective, all mask who we are in our experience. And so you're trying to suppress symptoms. You're trying to reduce, when you're feeling sad. And so you become less yourself, right? So you're even further away from sort of uncovering your trauma. And so again, one of the things that I just really appreciated about this therapy is that you get to the abscess that is in this disease and you dig that out, and then you can finally heal. So every drug therapy that's out there right now is pulling us away from that, right? It's pulling us away from really feeling and experiencing that trauma by just masking it and numbing it and dulling those symptoms, instead of recognizing that those symptoms are there for a very reason. Those symptoms are sort of ways of our body telling us that, that there is an issue and that we do need to resolve something. And so rather than trying to suppress those little fires, right, we need to be addressing them. And so by going in and addressing that abscess, you can really truly heal from this trauma and again move forward and have your resilience restored. I know that was another big question that came up is, okay, well, now we have this big fear that, all these people are going to be addicted to MDMA like they are, these opioids and, whatnot. And I'm sitting there saying, you don't understand. The opposite's going to happen. The efficacy of this is going to get out. It's going to continue to spread. There's going to be a groundswell of people wanting this. They're going to turn to the street for their supply. Then we're going to have bad drugs, right? Some people are going to get those.
Right. And people turn to drugs like opioids when they're suffering from PTSD. It's not the MDMA that's the danger as much as the lack of treatment for PTSD.
And then, but even if people are saying, okay, well, let's go, find therapists and let's go out and do MDMA ourselves and, and make our own therapy, that's high risk because you don't know where you're getting your drugs from. And so now we're going to create that kind of a crisis. Right. So I think to me, the bigger risk is when you have this groundswell of people saying, well, if this works, I need to do it because I'm desperate. But then we have a bad supply. We have, all these other issues. Does the FDA get to wash their hands of it at that point? I mean, to me, I feel like that's a much higher risk, and that would absolutely be on them.
Yeah. Absolutely. And it's a real false, the idea that if you do nothing, you haven't made a choice. And none of the consequences can be your fault. It's just not true. Doing nothing is a choice in this case. And I think I just want to go back to something you said earlier about, the idea of sort of suppressing the symptoms and suppressing the body's attempts to raise the red flag and say something's wrong here. Really, we talk about that a lot at Ketamine Insights, that like trusting the body as a healer and trusting yourself to know how to heal itself if given the right sort of soil to work in, to grow in. And that's a very different paradigm from the medical paradigm that sees itself going to battle with cancer, for example, going to battle with the bad parts of yourself, sort of breaking down the barriers and listening to the inner voice that's saying, like, this is what I need, this is the comfort that I need, is just a very different paradigm from the take a pill and you'll be better tomorrow.
As I went through my sessions, Molly, boy, do I understand the challenge of trying to convey how the trauma was resolved in clinical terms, because you're literally having a sensation of your brain restoration. Like for me, what came up was literally having, you look to the plant kingdom, it's having a parasitic vine lifted off of your structure as a tree in the forest, right? So now you can get nutrients and you can thrive because you're no longer coated in this, in this disease. It's another sense of literally having what used to be a fight flight superhighway open up into a very broad pathway with side streets and rivers and streams and walkways and bridges and all these options, right? So it's discernment around how you're going to react to something. And then on top of all of that, this sense of, in your own voice, in your own language, someone telling you what you need to shift your perspective. So I alluded to it in the hearing, but for me, it came in the form of realizing that any time in the past when I had been overwhelmed, I was experiencing almost a tsunami. It was really, violent water filled with all this debris. And, it was very scary and overwhelming. And to suddenly have in my own voice sort of a tap on the shoulder that says, Christina, stand up. And then to realize that you're merely in a puddle at your feet and that you are bigger than this, and that quite possibly your little 5-year-old, 6-year-old, 7-year-old self has been stuck thinking that all these things are looming so large when you've overcome it. You are resilient. You are still alive, and you're not still stuck back there, right? So how do you explain that in clinical terms and have people embrace and understand that this is medically valuable, and that this individual journey, if you will, is something that we just need to trust that it's going to happen for people. But it is happening. It is the way it's unfolding for people. People are finding their own inner healer, just like I did, that voice that tells myself what I need to do to meet the therapist on the outside so that we know what we have to work on. And no amount of unidirectional therapist telling me what I need to do would ever resolve that, right? But you don't know what you don't know until you get that assisted therapy, that assisted drug boost or reset button, if you will, to heal the cognitive ability, right? To heal perception, to heal, your biological response to stress, to then be able to unravel future stress and trauma.
Yeah, to sort of turn down the volume, as you said, the tsunami of consequences, and just have a moment to actually listen to yourself and be able to hear the truth, really hear the fact that it is just a puddle at your feet, and that that's such a powerful image, that you're, overcome, and then you realize, no, it's not the ocean, it's just a puddle.
It's perspective,
That I'm
right?
much bigger.
And to just truly be able to connect the dots. And again, I go back to, like, for me, having that revelation that it wasn't the index trauma, so to speak, that was the harmful, sort of a barrier to healing. It was the peripheral stuff around it. For me, there was also a little bit of sort of survivor's guilt built into this as well, in this realization that, potentially, a predator was very dangerous. Why didn't I do more to stop him? Why didn't anybody listen to me? I should have done more, all of those things that happen. But those are feelings of just shared humanity. It doesn't matter what the trauma is. These are all the same kinds of, feelings that we have. It's like soldiers in war feeling like, why couldn't they save their friends? Or, people in natural disasters, why weren't they able to hold up a wall or do some mega task, miraculous thing? Exactly.
Superhuman
in the moment.
thing.
These are all very common themes. And yet to have something that helps you get out of your own way to unravel it is so difficult to explain in medical terms. But we see it, we know it, we can prove it, right? People are really truly resolving their trauma through this therapy. So it's a challenge, I think, to try to figure out how to put this in terms that the medical community, as they have defined this, are going to feel comfortable with. But I think we can do it.
Right. And it was, to the extent that it was codified, it was able to show meaningful progress on the different scales that people use to report their distress. And you really can't ask for better results. That's not the drugs that we use today. It's a success if it's a 30%, in mental health, especially. As someone who's tried more than 12 or 15 different antidepressants, the idea of an 86.5, I mean, it just makes you want to cry, to be honest. And
right. And without having to take it repeatedly for the rest of your life.
For the rest of your life.
Right. I mean, there's just, to me,
Mm-hmm. Right.
again, I want to go, did I walk in the wrong room? Like, I just can't understand having the lived experience of being medicated by so many of these SSRIs. I mean, I
Yeah.
was even prescribed anticonvulsants and, you name it, because of bipolar. Exactly.
Me
And so,
too.
my
Right.
gosh, just
Mhm.
going through that, right? That is another trauma.
Yeah, the physical toll on your body. It is another trauma. And being told, oh no, all these years you've been on this, that probably wasn't helping. Maybe it's bipolar that you have. Let's try this whole other class of drugs. And maybe we were wrong. And just going through it over and over again. And yeah, the everything, the weight gain, sexual side effects, suicidal ideation, there's so many life-changing side effects. And MDMA's side effect seems to be insight and
And
inner
empathy and
peace.
positivity and,
you know,
and
empathy,
can-doism.
right? It's
Yeah,
self-acceptance.
exactly. I mean, to
Yeah.
be restored on this level, to rejoin the human race as a productive member, instead of feeling that you
Mm,
are somehow flawed and that there's something biologically,
yeah.
neurologically, fundamentally wrong with your character, instead of, like, I have the insight now where I'm like, oh my gosh, like, I don't want to say I'm amazing, but I'm pretty amazing for still being alive, for what I've come through. And so we should
Right.
celebrate that resilience on
Right.
the part of people that suffer through trauma. And why aren't we doing that? Why aren't we shifting that entirely, where we're saying, you know what, you're still here. That proves your resilience. Now let's get you back to that full resilient person again, so that you can keep marching forward. I mean, that's the shift that needs to
Hmm.
occur.
And talk about the ripples. We talk about the negative ripples, but the positive ripples of somebody being restored in that way to their whole family, to their community it's really meaningful.
It
It's really
is.
important.
Absolutely.
Um,
And I see the shift already, even personally, within, my circles and within my sphere of influence. And more importantly, it breaks the cycle, right, of it happening intergenerationally. So, especially with my son, when
yeah.
I see our family's generational trauma and the cycles, and I start to connect the dots through all of that, it's astounding how the wrong dots come to light, right? Just today I posted on Proteo Foundation's Facebook an exercise. It's an illusion where you look at it, and your eyes, can't discern between squares and circles. And I sort of likened that
Hmm.
to what happens to people who suffer from PTSD. Is over time you can no longer see both shapes. You start to only be able to see, one particular component. And I think it's important, because
Mm,
having people restored to resilience, to where they can see not only more accurate reality around their history, and they can see the right dots and both shapes, and they can connect the right dots, I think really helps people shift their
mhm.
narrative. It helps them understand that they aren't the terrible people they think they are, and
Yeah.
really truly be able to turn the corner and say, yay, yay me, yay resilience, and now I have, my
Mhm.
cup is overflowing and I have more to give. So, so what's that?
Right.
What's that worth?
Right. And to think of the partner, the child being raised by a person who's not clouded by shame and convinced that they have done something terrible and that it's their fault and that, it's a different
Yeah,
parent. It's a different partner after
absolutely.
recovery.
Yeah, who shows up.
Um,
And just not having that, the default switch in the wrong position, right? Where you're now able to see
right.
the positive in things, and you're able to pause and say, "Oh, that felt like a criticism. Was that a criticism? Did that, is that what I'm feeling? Is that what
Mm.
you meant? Like, can we explore this?"
Did you
Yeah,
mean it
and
that
hold
way?
that space.
Yeah. And hopefully,
um,
organizations like yours and doing the patient advocacy work and maybe podcasts like this, who knows, are able to kind of raise awareness and make it not so scary, put the drug war behind us. I want to give you a chance to talk about any plans you have with the Protea Foundation.
I would love to. Thank you. I think the biggest thing right now, and I fully agree with you, this is a mere delay, more than anything else. But what we are doing as a foundation, even if MDMA assisted therapy doesn't become available to our population that we would love to help, because that is one of our missions, right? Is to create more access to people who wouldn't otherwise have it, but is to focus then on the other two tiers of our mission. The first one is that community-based trauma education. It's connecting the dots between ACEs and childhood experience to trauma in the present time, and making sure
Yes.
that people are even having a dialogue around trauma and PTSD, and able to then find resources to get to trauma-informed therapists, because I think shifting away from blame and the disease model is so critical. So that's work we can be doing in the interim. And then training therapists on the modality of psychedelic therapy. So even though we can't be, providing the actual MDMA or that, we can still obviously be building up a much larger therapeutic base of people who are competent in this area. It's really important to me that we don't have people who aren't qualified in the space providing the therapy in this space. They do need to be aware of all the different, points of inflection, right? Have we really resolved suicidality in this patient? Are we at risk of this person, maybe becoming worse through the therapy because they're getting closer and closer to unraveling their root cause, but it can be very painful to get there and very scary. And so it's really making sure that there's a level of competence, to these
Yeah. And
professionals.
enough of those professionals to serve the demand once we're able to.
Once we're able,
Yeah.
but we'll see what happens in August. I'm doing everything I can in the interim. I'm, approaching Congress. I'm trying to be the activist. I am trying to learn how to be that voice in the room that is saying this is not okay, and it needs to be loud. So I really appreciate the opportunity to have like this platform, truly, because I don't know, I'm so new to trying to be an advocate for something like this, but I believe in it so wholeheartedly that this will save so many people. And this is, I have suffered from PTSD for 47 years, and I don't want anybody to walk a single step in that journey. So anything I and the people who join our community can do to even shorten that by a day, but more importantly, to instill that there is something good coming down the pike, right? We do have an effective therapy, and we just need to get there. Hope, I think, is the biggest thing we can instill on people who suffer from this. And that's our work right now. That's the first step we're taking. And I hope that we have a bigger job to do in August. It would be a nice issue to tackle, is getting everybody through that pipeline.
That's right. Well, I just want to thank you so much for the work that you're doing and the voice that I was just reading that New York Times article on Wednesday morning, so disappointed, and got to your portion of the article down at the bottom. And I thought, these voices should be at the top of the article. This is the problem. The problem isn't a bureaucratic one. The problem is a human one. And we're given this opportunity to alleviate so much suffering. And it really is powerful. It's so powerful the way that we advocate for ourselves, but also for each other when we have that common experience. So anyway, I just want to thank you so much for being one of those people, because it's really important.
The honor is mine, truly. I feel so incredibly lucky, really, that I had the opportunity to participate in this trial. I mean, those odds were extraordinary to have that opportunity. So it's also a felt sense of responsibility. I was given a gift, and it's time now to turn around and really do everything I can to share that. It is absolutely unfair to me that this isn't something that is available now, today, to anyone who suffers. This is so exciting and so amazing, and it needs to be shared. So yeah, I love that people get really motivated to help each other through
Hmm.
things like this. It's almost like trauma is so pervasive that people don't really want to believe that it is something that impacts all of us, and yet we know
Yeah.
this. You look at the root cause of so many of our social issues,
Yeah.
and it is mental health related. And so,
Hmm.
again, this impacts us on such a fundamental level. And so, from my perspective, it's like if I were looking at the best place to invest a dollar, it would
Hmm.
absolutely be in a root cause solution instead
Right.
of band-aids. I really think this has that potential to really cure a lot of what ails us as a society. So thank you, Molly. Really
Thank
appreciate
you.
being able to
Thank you
talk
so
about
much for
this.
taking the time and sharing your story and joining us today. I really, really appreciate it. And hopefully maybe we'll have another call in August with good
Would love it.
news.
Stay in touch and let me know how it goes. If I can ever be of any assistance, you let me know.
Okay, thank you.
Thanks for listening to this episode. If you liked it, please share it with someone who might find it helpful. And if you want to help keep the podcast going, you can support us by subscribing through Patreon or Substack. Just go to those platforms and search for Ketamine Insights. This episode was hosted and produced by me, Molly Dunn, and our theme song is by Solid State Symphony. See you next time, and in the meantime, remember to advocate for yourself and never ration your joy.